morning, everyone. My name is Chris Weylman, and I'm the dental hygienist of Hope Health. We are a palliative care and VNA services agency out of Attleboro, Massachusetts, and I am the program coordinator of the Elder Dental program. So there's generally three sections of my job. One is to come out and do education like this out in the community. The other is to run 2 free dental screening clinics, and they move within my service area, which is approximately 23 towns, which is about from Dedham down to Fall River, not the South Coast. And in those free dental screening clinics, all you have to be is 60 and live anywhere in Massachusetts. There is no income or asset cap for those oral cancer screening clinics. They are open to anyone 60 and older. And then the third part of my job is the Elder Dental program, which is a income and asset-based program where we match seniors with a dentist in the community on a sliding scale to provide dental services to the seniors. So we're going to get started on the education piece today. I just wanted to talk to you just a little bit about proper brushing. I want to make sure that people are using a soft toothbrush. You want bristles that flex just a little bit, because if the bristles are too hard and you scrub too hard along the gums, you're going to cause something called recession. Recession is this, when the gums push up over the teeth. And the reason that this is, first of all, it's uncomfortable because you can feel temperature variations in the mouth, but also you can get cavities right along the root area because it does not have the hard protective enamel coating that the enamel has on the crown of the tooth. So you want to make sure that the bristles have a little bit of flex to them when you're brushing up here, and you don't want to scrub back and forth. So sometimes people have some difficulty as you age with arthritis or anything like that in their hands. So I'm going to go over just a few adaptations for you with a toothbrush. So here's your toothbrush. One of them is a tennis ball. You just take a tennis ball, you poke a hole in it with a knife or screwdriver. You place your toothbrush in, and then you've increased your grip on the bottom of the tennis ball. One of the other things you can do to increase your grip is there is all kinds of putties out there. This is a putty that's used in physical therapy. You can take that and you put it right around the neck of your toothbrush and you mold it to your hand so that you have a larger area to grip. Next part I want to talk to you about is interdental cleaning. There's a couple of different ways that can be done. Obviously, just a piece of floss is fine. There are some floss aids that are out there. These are little plastic guides that have a piece of floss in them. And the thing I want you to know about this is that when you're using a floss aid like this, going straight down and pulling back out is only doing part of the job. You really want to make sure that you're giving that a little bit of a tug to create a C around the tooth and go under the gums. And the reason it's important to go in between the teeth and under the gums a little bit is that you want to remove the food and debris from underneath the gum area. Here's a chart where you can see, I don't know if anybody's been to the dental office and you hear them say a lot of numbers, 2, 3, 3, 3, 2, 2. We're measuring your gum pocket, and that gum pocket is like around, it's like a turtleneck around the neck of your tooth, and it should be between 1 and 3 millimeters. But when you leave food and debris in there, that's when you get problems with gum disease and or cavities, depending on the type of bacteria that are there. So here's somebody who's having some problems with gum disease as the pocket turns a much redder, inflamed, and they've lost some bone. So you got to make sure that you do some interdental cleaning, and like that there are a number of different ways. Another one besides the floss, your straight piece of floss or this, is a more mechanical one. It's called a Waterpick or a water flosser. There's a countertop model. This one is the cordless model. The reason I like this one is it has a very large grip for you if you're having any problems with arthritis in your hands or grip, or even frozen shoulder to try to get it up. It's a little bit easier to do that. So with the Waterpick, you want to make sure that you're angling the Waterpick at about a 45-degree angle to the teeth and tracing the teeth right along. It's not just shoot it in between. Again, that's only doing part of the job. You want to make sure that you're thoroughly lavaging in between the teeth and getting the plaque out in between the teeth there. There's some other aids I'll show you. I have some smaller ones. If I can get my toothbrushes to disintegrate here. This one is called a Proxy Brush. It looks like, if you remember a bottle cleaning brush way back in the day, it's a very, very tiny one. And sometimes they come in a Christmas tree shape, and sometimes they come in a cylindrical shape like this. You just have to find which one is best for the opening that you have in your teeth. So sometimes it's a little trial and error to see, or you can ask your dental professional which one they think would be best. But this one, it goes in between the teeth like this, and it cleans out any plaque or debris in between the teeth, like that. There's one more adaptation I want to show you, and this is for somebody who has quite a bit of grip issues, and or I found this helpful if you have anybody who's having memory issues and perhaps can't remember to brush their teeth or what a toothbrush is, but if you put a toothbrush in their hand, they know what to do with it, but then they would forget in a few minutes. So I'll step out here so you can see. This costs about a penny to do. It's an elastic band. Just take it and you lay the individual's hand down, you put the toothbrush down, you pull up over the head, over the tail, and then the toothbrush is on the hand, so that the individual can participate in healthcare and they don't have to grip if they don't need to, if they're having some problems. Now I'm going to talk to you just a little bit about denture care. Denture care, I don't have a denture. What I have is an athletic guard for my children. So we're going to pretend it's a denture for a moment. You want to make sure that you're taking your dentures out at night. If you feel uncomfortable sleeping without dentures at night, you've got to pick a period of time during the day to take your dentures out and soak them. You should soak them in water is fine, a cup is fine. This is a denture case, put them in, fill it up with water. There's effervescent tablets that you can use to clean the dentures, but you also want to make sure that you're brushing your dentures. The effervescent tablets are not the end-all be-all. You need to make sure that you're doing some brushing of the dentures to remove any of the plaque and debris. So you want to make sure when you're brushing your denture that you're over a sink, whichever sink you're in, and you want to lay down a face cloth or some type of towel in the base of the bin. And then you want to brush your dentures down as close to the sink drain hole or as close to the face cloth as you can. Because if you're up here brushing your denture and you don't have some protective layer down there and the denture goes like that, well then you could be out quite a bit of money if the denture breaks. So you want to be down as close as you can. You want to use the flat end of the denture brush to brush the outside of the denture, and you want to brush with the tapered end on the inside of the denture. So another thing, if somebody's having some issues, but they still want to participate in their oral health care, you can make something for either the bathroom or any area in your house. It's a piece of plywood. It's 2 pieces of Velcro. And this particularly works well if you have somebody who maybe has had a stroke on one side and can't hold their denture and brush with one hand. They can do this one-handed. You can put the denture on, and then you put the piece of Velcro on. I think my piece of Velcro is cold from being in the car this morning, so it's not staying on very well, but then trust me, if it wasn't cold, it would stay on. And then they can brush the denture on the piece of plywood, and it would be C-clamped to the side of your sink or your desk. And then when this gets kind of yucky from the denture toothpaste, because you do want to use a denture toothpaste with this, or if you soak it in an effervescent tablet, you can just brush it afterwards. You don't necessarily have to use the denture toothpaste. So the C-clamp would be holding that. You can just get rid of it and make another one because they're not very expensive to make. So that's for denture care. Anybody can ask questions along the way. You're a quiet audience today. Very quiet, very quiet. the last thing I want to talk a little bit about is diabetes and gum disease or any other conditions that affect you chronically. If somebody who has diabetes in particular, I'll use diabetes in particular as a disease, as a chronic disease. If you can control your oral health care, it can help control the amount of inflammation in your body, because this is a chronic inflammation system here. And when you get to a part where if you're controlling your home care and keeping your gums in check, the diabetes has less of a chance to throw off your blood glucose numbers. This would probably throw off your glucose numbers, this would probably not. So you want to try to do that for overall health, keeping your overall health in check. And then I want to talk a little bit about dry mouth. So a lot of times people experience dry mouth. So we generally put out about 2 liters of saliva in a 24-hour period. Taking medications usually cuts that in about half. So you usually in a 24-hour period you're putting out about a half of 1 liter of saliva. And saliva is really important as you keep moving food and debris and things around your teeth so that they don't settle to cause cavities. And it also helps you with speaking and eating and chewing and just your general function of your mouth. There are a couple things. You can use re-wetting drops. They're similar to like eye drops, but they're called saliva substitute drops. And you put 2 or 3 on your tongue, and it kind of gives you that slipability in your mouth. You can use it, yeah, sure.
What are they called again?
They're called saliva substitute drops.
You get those in the CVS?
Mm-hmm. In the pharmacy, you can ask your pharmacist for them.
Thank you.
Yep. And there's also, you can use a humidifier at night in your bedroom if you can. If you don't have a health condition that precludes you from using a humidifier, that moisture will help keep the tissues of your mouth nice and moist and help keep things kind of moving around. There are some products on the market. There's Biotene, and there's a lot of different kind of mouthwashes. You just want to make sure you're staying away from alcohol-based mouthwashes. They're great. Alcohol-based mouthwashes are great if you have gum disease. That's a different problem than if you have dry mouth. You just have to weigh up your options on what you need more. But you want to stay with an alcohol-free mouthwash. Biotene also has something called an oral balance, which is very similar to the salivary drops, where it helps keep your mouth in a balanced formation. And it's a gel that you put inside your mouth that helps you stay there. And then there's some new technology. This one's called Xylamelts for dry mouth. And these are little pellets that the gray side you put inside on your cheek, and it slowly dissolves over a 12-hour period, and it helps give you some moisture in your mouth. Some people like these. Some people said to me, I feel like a chipmunk that I have things stuck in my cheeks, and it's, you know, they weren't comfortable with it, but they're easy enough to try. This the small sample packs of the Xylamelts to go in there.
Does it all stay like permanently, or do you change?
No, it just dissolves away. The whole thing will dissolve away in about 12 hours. So you put it in and it dissolves, and if it's working for you, you can put another one in. I think you can use 2 or 3 a day, they say, on the thing, so those ones go. And so that's all of my oral health education for today. Thank you for being with me.
I have a question.
Sure.
Is the Waterpick heavy?
No, you can, here.
Okay.
The one thing I will say about the Waterpick is this is a very small water reservoir, so you have to refill it often. Whereas the countertop model has a much bigger water reservoir, and that one you don't have to fill as often, and it also has a little bit more power than the cordless one.
Okay.
I think.
It just seems like it would be good for grip, but heft might be an issue, but it's not.
But
You
I
find that?
don't find that too heavy. I don't know.
Yeah.
I don't know. No one's ever said anything that it felt too heavy. I mean, this one obviously has no water in it, but the grip is good, and because the other one has got the cord that it's corded, and I feel like people have a harder time pulling the cord.
Okay.
So, but I haven't had any complaints about maybe that's part of the reason why the reservoir is so small, so it doesn't get too heavy for the individuals to pull on.
Could you say a little bit more about the Elder Dental Program application process and criteria?
Yeah, so the Elder Dental Program, the nonprofit program that I run, there's a free application to come into the program, and you have to be 60 or older. You have to have no dental insurance, and that means an Advantage program or straight up any kind of commercial dental insurance. And it takes about 7 to 10 days once the application is received into the agency for a match to be, for the application to be processed and a match to potentially be made with a dentist. And then the individual pays on a sliding scale. We have about 109 procedures on the fee schedule that seniors would get a discount on for dental services.
I have a question too. What about preventing enamel falling off from your tooth?
So that's usually fluoride's job, is to have enamel protection. It's good home care, obviously, because you don't want bacteria and food and debris around the teeth. But the fluoride, so you want to use a fluoride toothpaste?
This is in the front of the teeth.
Mm-hmm. The front of the teeth, it's all of the teeth. The enamel is the same. If it's, is it fillings that are?
No, one time I had the tooth next to my front tooth have the enamel come off overnight one night. It was really a shock.
Yeah, sometimes it's you've bitten something, you know, sometimes you just don't know, but to strengthen enamel is generally the fluoride's job, is to strengthen that enamel up. Make sure you're not biting on really hard things like frozen, you know, Snickers bars or, you know, anything really hard. Sometimes that can affect the enamel, the shearing of enamel, so.
Is there any way to repair enamel?
Other than bonding, having white fillings bonding done, that's the only way to repair the enamel to get it back to its natural looking state. Yeah, it doesn't quote unquote grow back, you know, there's no way to get your, enamel doesn't grow back, it's just, you have to get it back through a mechanical dental office, yeah. Anything else? And Sherry's going to talk a little bit about resources, other options?
Other options, but I'm looking at your handouts and I think you need to jump in here.
Okay, sure.
You know more about these things than I do. So my name is Sherry Norman. I'm the director of the Senior Center. I'm also a SHINE counselor. SHINE stands for Serving the Health Insurance Needs of Everyone on Medicare. So that's a big job. When people come to us and ask questions about dental options, and happens a lot, because Original Medicare does not cover dental. It's a shock to people coming off a group employer plan when they're first Medicare eligible. Most people at a good company are used to a robust dental insurance policy for relatively short money, and we have to tell them, sorry, no coverage under Medicare for routine services such as cleanings, fillings, that sort of thing. SHINE has this handout. It's usually very colorful. Chris calls it the rainbow. I don't know what happened to my colored version, but encourage people, if they have more questions, to make an appointment with the SHINE counselor and find out, you know, what are available, what programs are available. So as Chris mentioned, there are private insurance that people can buy to supplement the dental coverage. They're not great. The premiums are you know, generally higher than the services, or the many require that you pay into a certain period of time before you can even, you know, get coverage, or there are maximum, you know, limits, annual limits, which aren't particularly generous. There are a couple that look like, you know, reasonably good deals, but like with all insurance, you have to really kind of shop around. There are some Medicare Advantage plans which cover some routine dental coverage. That has been expanding over the years. There are a number that cover more restorative kinds of services than they used to. But again, Medicare Advantage plans don't work for everyone for other medical services, so I wouldn't tell people to just automatically go on a Medicare Advantage plan to get the minimal dental coverage, because that may, you know, not be the right choice for other things you may need for your insurance. So that's why talking it through with the SHINE counselors is a good idea. There are some university college dental programs which offer discounted services. You have students work on you. Similarly, there are some community health centers which offer some dental coverage. Unfortunately, we don't have a lot of those close to us, but if you want to go to Boston for certain services, that might be an option for some people. There are also, if you're Mass Health eligible, there are more options. But again, my understanding is there's pretty long waiting lists for a lot of these dental programs that are subsidized for public benefits.
I've heard last, but.
There are also some things on your sheet here, Chris. I don't know if you want to talk about them, dental resources.
Sure. So along with private dental insurance or commercial dental insurance, and Sherry mentioned the dental schools in Boston, there is Bristol Community College in Fall River has a dental hygiene program, and dental hygiene students are overseen by licensed hygienist and a dentist on the clinic floor, and they will do cleanings for a donation of $10. And there's also Regis Dental Hygiene College in Waltham, Mass. And they offer a number of services, and they range from $20 to about $150 for their services, but they are also discounted. There's also Forsyth School for Dental Hygienists, that's in Boston. And similarly, they offer discounted dental services for dental hygiene visits. And then because we are so close to the Rhode Island border, there is CCRI. I don't actually know their cost of their dental services, but CCRI is also another option for people. So,
And I think also on here you talk about dental discount
programs.
You might even ask your own dentist. Lots of times, like with doctors or any providers, you don't necessarily want to change just to get one particular service. So, and if it's someone that you've been working with for a while, they usually work out some sort of a payment plan or something like that. And you have a few here. I think some of these are offered through, you could ask your dentist if they work with a particular discount program to get, some sort of a discount or a payment plan in place. There's also something called Choosy, which is CHEWSI, as opposed to SY. So it's, where you get your pet supplies, the different Choosy. And that, again, offers some discount. It's a free, you can either get an app or call and become a member. It doesn't cost anything to become a member. And they work with participating dentists for 20 to 30% off all services, including restorative. But, that's what most people are looking for. They're concerned, what if I need a crown or a bridge or a root canal, something like that can get very expensive. So there are options available. It just takes a little bit of homework to figure out what's going to work for you. So I think
Yeah, and if you have any questions, you can reach me at area code 774-203-1326, and I can see what I can do to help navigate you through some dental care.
Thank you.
Thanks.
You're welcome.